The new variant of the virus means that we all have to be concerned about how best to organise a return to education on the 4th of January. It was clear at the end of last term that cases were going up sharply amongst primary and secondary children. The Office for National Statistics Coronavirus Infection Survey suggests that they are now the two highest of any of the age demographics. Now, we can hope that cases will fall slightly among school children across the Christmas period because schools are closed. But we have to be concerned that with the new virus being 70% more transmissible, and with some scientists suggesting that that might be the cause of the increase in school-aged children, we do have to get things right. What we don't want is children who are positive coming back to school, infecting other children, then infecting their families or infecting education staff. We have to bear in mind that education staff have neither PPE nor social distancing in their classroom settings. Now, if the government had an accurate and efficient system of mass testing that could test children before they return to school, that would be a big step forward. But it doesn't look like the government has got that system in place for the 4th of January. So what should we do? The National Education Union recommends 3 steps that we think would improve continuity of education across the spring term. Firstly, the government in Westminster should follow the government in Scotland and announce that the first 2 weeks of learning will be online, apart from key worker and vulnerable children. That would allow cases to fall further, and it would allow time to set up the programme of mass testing. Secondly, the government should ask the local directors of public health to set up those systems of mass testing. The government should support them by launching an advertising campaign to recruit the staff and or the volunteers that they need. Schools would be really pleased to work alongside public health in making sure there is space that testing can happen. Thirdly, they should vaccinate education staff during that 2-week period, because one of the causes of disruption of education is the relatively high levels of staff absence due to the virus and due to self-isolation. So those 3 steps, online for the first 2 weeks to get cases down and to get mass testing set up. Mass testing set up by directors of public health, then to run that every week so that children with the virus do not come back and we find children quickly. And thirdly, vaccinate the teachers and support staff for greater continuity of education and because they don't have PPE or social distancing in their classroom settings. We think those steps would improve continuity of education. Thanks for watching.